Welcome to a space to speak your mind.
A radio programme and podcast about mental health and well-being.
Made by people with lived experiences.
And in association with Cornwall Mind.
We do cover subjects some listeners may find distressing.
So for more information, help and support, please visit cornwallmind.org.
A space to speak your mind with Cornwall Mind for better mental health.
Welcome to the September show. I'm Richard, and on this month's programme, JJ and Jenny will be chatting to Claire and Joe from Cornwall Mind to give us an update on the Mental Health Transformation Project. And as we're about to celebrate 4 years of the programme, we're teaming up with Chris from York Mind, who produced their very own mental health podcast called Chat-Chit, to talk about the origins of A Space to Speak Your Mind and to discuss putting together the two shows and how each one has developed.
A Space to Speak Your Mind with Cornwall Mind.
Back in April, I spoke to Claire from Cornwall Mind to find out about the Mental Health Transformation Project. You can hear that conversation now by searching A Space to Speak Your Mind on your favourite podcast app and looking for the April show. And Claire's back, joined by Joe, to give Jenny and JJ an update on what's been happening in the last few months.
A Space to Speak Your Mind.
Welcome to A Space to Speak Your Mind. Claire and Joe from Cornwall Mind, Living Experience co-coordinators. Claire, welcome back to the show.
Hello.
Do you want to quickly explain the aim of your project, please?
Indeed. So the project is called Community Mental Health Transformation, and the NHS are working on a number of recommendations and changes to improve mental health services. So this is really about kind of ending siloed systems, looking at a more person-centred, trauma-informed approach, making sure that people sort of don't fall into the gap where they can't access services. And our part in that project is to make sure that the voice of lived experience is incorporated. So that means that people who have, used the services or perhaps have tried to use services and haven't been able to access them, to share their views and share their thoughts on how services are transformed moving forward. So what we've been doing is we have a group of people with lived experience. We have now 13 people in our group. So we call them experts by experience because they have obviously lived experience and they are an expert in what they've experienced. And we get involved in different projects. So it might mean coming along to a project meeting with people from the NHS. It could mean doing a focus group. It could mean being part of a working group. So we've done lots of different activities in the past 6 months.
Can you tell us a bit about some of the specifics about projects that have been going on over the last 6 months that the experts have been involved in?
Yeah, so the project is broken down into different areas really. So one of the things is how different parts of the system integrate together. So, for example, the GP surgery and the kind of services that you can access there, how does that then link into the community mental health team? So there's a project around integration there. There's a big project around the community mental health team themselves, how you access those services, what do those pathways look like? There are a number of focus areas, so there are specialist teams within the service, so things like eating disorders, physical health, complex emotional difficulties, community rehabilitation. So if you've spent some time in hospital, what does that look like once you come out? So these are some of the different project groups that we've been involved in. And then underpinning that is sort of what digital tools can we use to help people with their mental health, both in terms of what people can use themselves or how do different parts of the system talk to each other. So there's a digital aspect to that. The other thing underpinning all of that is then how do we communicate this? How do we communicate this to potential people wanting to access the services? How do we communicate this within the NHS itself? How do we make sure that everybody knows who to talk to about what?
And a couple of months ago, there was an event called the Scrum Week. So I was involved in that. I was one of the experts by lived experience. That's another part of what I do with Mind. So I'll talk a little bit about what my experience of that. But do you just want to, you and Joe, maybe explain what the Scrum Week was? Because it's a bit of an odd name, isn't it?
It's a bit of an odd name, and we don't really like the name, if we'll be honest. So Scrum actually is a project management term. So when you're working on a big programme of work, there's lots of different sort of jargon that people use. And Scrum is basically a way of kind of brainstorming in sort of quite a short space of time, a project. So I guess it's a bit like a rugby scrum, we're kind of getting together. So we had people from the NHS, we had people from our group, all getting together in a room, essentially. There was about 30, 40 people on average per day, so it was a big group of people. And there were senior clinicians, so there were some psychologists, psychiatrists, nurses, all levels, people who deliver the service on the ground. Everybody was in the room together, including our experts. And the process involved each day we would focus on a different aspect that we were trying to solve. So, one day we might be talking about, well, what does the route into the service look like? Who talks to who gets involved in what part of that process? So there was lots of brainstorming, lots of conversations, lots of scribbling on the wall and kind of post-it notes and all this kind of stuff to basically come up with ideas collaboratively. And that's the point of what we call co-production. So this is kind of like a term that we use, which means working together equally to come up with solutions. That's kind of the essence of co-production.
So I found the Scrum Week really, really positive. Both of us started in February and we had quite a lot of figuring out how the project worked and how we were going to work with the NHS. And to start with, we were mostly doing 1 hour monthly meetings on the different parts of the transformation programme, which is great, but a lot of those meetings is just action logs and there wasn't much chance for discussion. So when the opportunity to do the Scrum Week, where we were all going to get into a room with the clinicians and the experts by experience and actually have a conversation and have the time to have a conversation, I thought that was really positive. I was a bit anxious about going into doing it because we hadn't done something like that before. We knew it was going to be quite a lot of people in one room. So there was a lot of figuring out beforehand how that was going to work. And then when we actually got in the room, I thought it was really, really positive and everybody seemed to work together really well. I had been a bit anxious about any potential friction, but on the days I didn't notice any real friction and people were working together quite equally, it felt. The only thing I would say is it's quite intense being in a room full of 40, 50 people with lots of loud noises and people talking over each other. So that was a bit challenging. But when we had the chance to separate into different rooms and really get into the nitty-gritty, that was excellent.
Yeah, I think because I was there as one of the experts by experience, and I found it, as Joe says, it was really anxious beforehand going into that space because, I was going to be with clinicians who'd been involved in my care or people who were responsible for arranging my care as somebody with long-term mental health problems. So I was quite worried about being there on a different level with them. It wasn't like a service user and a clinician level. It was we were there as equals in those meetings. And I think that was quite hard transformation to make, both for me. I feel a bit uncomfortable saying expert at times, even though, as I am reassured by Joe and Claire, I am an expert in what I've been through, but also being there with clinicians who have previously seen me as a service user and not been used to hearing me voice an opinion about the care that I'm receiving. But I actually found people were incredibly open to not just listening to what we were saying, like it wasn't just about creating a space for us to talk about our experiences, but they were hearing what we were saying, and you could see directly that changes were being made to the process of supporting people with long-term mental health problems or people with any mental health problems directly from what we were saying where there were issues. And there were, there's a lot of stuff that we can't make a change to, but there were definite areas where I felt we were being listened to, were being heard, and our opinions and experiences and our thoughts were being taken on board. We spoke a lot about how important it was for us to have a voice about our care and to be kept fully informed about what was going on with our care. Also, if there were challenges providing care for us, be really open about that, saying, we think you need this, but it's not available at the moment. This is what we will do in the meantime. So I think whilst it was a really, really intense week to get involved in, I'm really hopeful that change has already happened. They have put into place some of the changes that they're going to make, especially with regards to how people immediately access mental health support in Cornwall, but also in the longer term about how people are supported with a more rounded care and more supportive handover when you're moving through the system. So it's not like you finished this aspect of your care, we're going to do X next, but in the meantime there's nothing in between that. There's more of a call it like holding your hand, so you just passed between the different services in a much more supportive way. And I thought that was brilliant to hear and feel part of that process. And I genuinely do believe that people involved in the transformation project in Cornwall are really quite invested in involving service users and really taking on board what we have to say. So it was really empowering, but very exhausting. Joe, you've been involved with this kind of project for about 6 months now.
Yeah.
Do you mind explaining a bit about how your own lived experience benefits you in carrying out your role?
Yeah, I started in February, and this is a completely new area of work for me. So my previous experience was actually completely different. I worked in a museum and I was a learning officer and spent a lot of time teaching school groups. But I have my own lived experience in that I was diagnosed with bipolar, and through that I spent a lot of time figuring out bipolar once I had the diagnosis, because I'd been unwell a couple of times with time off work, and I was really keen to make sure I didn't become unwell again. So I took part in a programme called Bipolar Education Programme Cymru, because I'm from Wales, with the National Centre for Mental Health, and that was really, really positive experience. It was a 10-week programme, getting in a room with other people with bipolar, finding out about bipolar and how to live well with bipolar. And as part of that, there was actually someone who'd been through that programme before who had experience, and I found that really, really valuable. And then in 2019, I got involved with the Time to Change campaign that Mind run, and it's an anti-stigma campaign raising awareness around mental health. So I had experience of volunteering in the sort of mental health sector, but I hadn't worked in it. So when the job came up in the end of 2022, my wife said, you should go for this. It's a lived experience role. They want someone with lived experience. And I thought, I don't know, this is a completely different sector, but I thought I'd go for it. And I felt like the experience I'd had with the Time to Change campaign was really valuable. I'd attended a few conferences and things like that just to help run their stall, and I'd written several blogs on my own experience. So I thought I'd go for it. I felt like I had something valuable to give to the project, and quite passionate about improving mental health services. I haven't used mental health services in Cornwall, but I have used them in Wales. So I felt I had something to offer the project, and part of that was I feel like my lived experience allows me to give empathy and understanding to the people we're working with, and I have an understanding of going through mental health services, not in Cornwall, but my experience in Wales I feel is relevant to that understanding and what works well and what doesn't work well. But I think one of the difficulties for me is I do have lived experience, but I also don't want to talk on behalf of the experts by experience. So it's a fine balance for me to offer my experience, but also to not to take over the conversation. So I'm always keen to give the space for the experts by experience to be able to have that voice rather than talking on behalf of anyone.
And I think that's something that I find really valuable, the fact that both you and Claire have lived experiences, that you understand what we've experienced and barriers that we might be experiencing, so you make it an easier environment for us to have our own voices. And also you provide role models for us, because I'm really keen on promoting the idea that people with mental health problems can work if they are well enough to work, and to see people who've been through experiences of bipolar or other mental health problems and are in a stage where they can work again is really inspiring.
Thank you very much. Yeah, I really appreciate that. And I do think sort of the work I did with the Time to Change campaign was part of my recovery journey, and doing this role is almost sort of the pinnacle of that recovery, because I've been able to turn what was quite an unpleasant experience and then the diagnosis into something really positive, and that really helps me as well, and it's nice to hear that it's helping someone else. I think one of the things that I think both Claire and I are very conscious to make sure that we want to give experts by experience the voice and empower you, but we also remind the NHS that best practice for working with people with lived experience. So part of that was with the monthly meetings we do. We have the pre-brief with people in the room, so the chair and the project manager and expert experience and myself, to have a quick discussion before you get into the main meeting, so you have a friendly face. And then there's a debrief afterwards, so we can discuss what went through and any feedback you have. So we're really conscious that we want to make sure that we're offering that support that you guys need as well.
Definitely. And I think it's interesting what you were saying there about how you talk with the NHS providers about the importance and the gold standard of involving service users. And I think that's something that I'm seeing change, although probably only just starting to change, is service providers valuing the voice of service users. And there's a kind of like the mantra that's used when trying to involve service users about nothing about me without me. And I think it's moving beyond just a mantra now, and people are actually taking it seriously and seeing that we may be unwell, those of us with mental health problems, but we can still have a voice, we can still have a valuable voice. And what you two are doing is supporting us to have that voice.
And I think something that I've picked up on, I've been attending some different webinars, because what's great about this project is we're also part of National Mind, so we get to talk to other minds that are doing this kind of work and other trusts that are also embedding co-production, and again learning from that best practice. And something that I heard, which I really, really liked, is moving away from what's the matter to what matters to you. And I think, again, that's a really big kind of cultural shift, because, you know, it's not about, as we're saying, things being done to you, but you being an active participant in your recovery journey, which, again, is really, really important.
Yeah, and I think that's a really key point, is that it's those of us with mental health problems being involved in our recovery and empowering us to be involved is actually going to lead to better outcomes, because we have more ownership over our own mental health and therefore make bigger strides in recovering as well. I think that is really, really important.
So can both of you guys tell me what's the plan for the near future for the group?
So I think really this is all an evolving process. So as Joe mentioned previously, we started off just kind of attending project meetings, and, you know, that was a start because we were a voice in the room where we hadn't been before. And I think even when you're in the room as a service user, as a client, you know, the dynamic changes in that conversation, which is really important. So now we did the Scrum Week. We're planning to do more kind of working groups. So now that they've seen how well that worked, we've got some working groups coming up around physical health. If you have a serious mental illness, you are entitled to kind of physical health checks as well. So we're kind of looking at what does that process look like and how can we make that better. We've got some other workshops coming up. So we've got Scrum Week Part 2 coming up in October. And then there's some other digital projects that we're hopefully going to get involved in as well. So there's lots coming up. So for me and Joe, it's really about continuing to kind of promote effective, proactive involvement with people with lived experience. We're gathering feedback from the experts like Jenny and saying, you know, how was that for you? What could we do better or differently to make sure you're supported in that? And sort of how do we iterate the process based on that feedback? And also the NHS, you know, how they finding engaging with the group? And then looking at how we can just embed this more widely. So rather than it just being, you know, one-off projects, how can we make sure that this is like how things are done in the future?
So Claire, could you tell us how to get in contact with you?
Yep, so we've currently got a couple of cohorts of experts by experience. So at the moment, we're not looking for anybody else for that group. However, we do have the opportunity for people who just want to do some focus groups or like reply to some surveys. So we have a newsletter that you can sign up to. And what we'll do is we will pop the link to that in the information for this show.
And now something different for A Space to Speak Your Mind. As we approach our 4-year anniversary, we do something we haven't done before, talk about ourselves. Now, you may not know this, but as part of this very programme, Cornwall Mind runs a wellbeing group that help produce the bits that you hear in the show. Well, we're joining forces with Chris from the Chat-Chit podcast, run by Cornwall Mind, to talk about our 2 podcasts and what goes into making them. So I'll let Chris introduce this part of the programme.
Well, this is a bit of a different episode to normal because I came up with the name pretty much off the cuff. And so obviously, welcome to Chat-Chit, but this is actually going to be a space to chat-chit about your mind, because this is an episode where we're teaming up with Cornwall Mind to discuss what it's actually like to produce a mental health podcast. The trials and tribulations, the successes, the worries, and how it's both come about. So we've produced a podcast called Chat-Chit. So you'll be listening to us maybe as a regular listener, maybe not. But you also might be listening from a different end of the country. And today we have got Richard from Cornwall Mind, who produces a podcast called A Space to Speak Your Mind. Hello, Richard.
Hi, Chris. How are you?
I'm all right, thank you. We usually start with a check-in. Do you want to do a check-in?
Yeah, so I mean, it's really good. We're recording our new show now for September. The summer has completely flown by. Where we've been in Cornwall, it's not been the greatest summer. Probably for you a little bit, you might have had a week or 2 of nice weather, but for us, it's been awful. So I'm a summer person. As we get into September, I'm kind of thinking, okay, maybe we just have to wait till next summer now.
just park this summer as just as not as one of the best ones, and we'll move on to next year and go with that. Is there anything you need to get off your chest this week, Richard?
Everything's kind of good. We've, as we'll talk about within the podcast that we do down here in Cornwall, we have a wellbeing group. So we've just come to the end of our wellbeing group for the radio programme. It's been really successful. We've got some great content. The guys have done so much great work on the show, and it just feels really, really good. And we're starting a new one up in September. So by the time you're hearing this going out, we will have a new wellbeing group for Cornwall Mind producing radio content about mental health.
Do you know what? If you are listening to this, you're going to be like, who is the host of this podcast? And it's like, we've kind of just blagging it and we're going with both of us. So
pretty much, yeah. This will be confusing. So this will be airing on the radio stations down here in Cornwall and also as a podcast. But of course, you've got your podcast up there as well. So it'll be going out pretty much the same bits that we're talking about now, but you can hear it on either or.
You can hear it on lots of different wavelengths, podcast and everything. But yeah, so like I said, we're going to be talking about kind of our favourite moments on a podcast, what we found most difficult. What's my check-in for today? It was nice. I played cricket at the weekend, and honestly, we've had so many games rained off this year because of the weather. We managed to get a game in, and I've actually played well for once. Like, I've been waiting all year to actually score some runs, and finally I've scored some runs. So that's been a nice weekend to have.
Well, that's really good. Obviously, being active is so important. And I play tennis 2 or 3 times a week. I go for a run. I did park run at the weekend as well. So that's my kind of release. I love getting out there, and I'm sure you get the same kind of benefits as well.
100%. I think that massively affects me when I get ready for summer and I'm waiting for it to be nice weather so I can get out and play cricket, I can play golf, and then it starts raining. I'm like, I've chosen the 2 worst sports to play in the wind and rain. It's not like I can go kick a footy or play some rugby in it, but yeah. I'm
the same with tennis. If I knew there's some rain coming and it's going to be cancelled, that puts me in such a bad mood because that's my release first thing in the morning, go out there, knock a few balls around, and then I'm good for the rest of the day.
Absolutely. To start with then, I want to just know, how did your podcast come about? How did A Space to Speak Your Mind come about, Richard?
So what we had here in Cornwall in late 2019 is our local community radio station approached Cornwall Mind and said, we want to have a 1-hour monthly radio show talking about mental health, and would any of you want to get involved? My background, strangely, is radio. I hadn't at that point done radio for many years. I joined Cornwall Mind to run some of the physical activity groups and to facilitate the yoga group as well. So that was kind of where I was, really. Then I thought within Mind are always saying about how talking is important and we should be talking about mental health. And I just thought this would be a great way of having a radio show where people can come on and talk about mental health. And from the very start, the idea was it was going to be about lived experience. So that's what we were going to do. And from there, a group of people, some that were with Mind, some with the local community station, got together and we started to produce the monthly 1-hour mental health radio show.
No, and so how long has it been going now?
So as I say, we started in October 2019.
It makes me think, I go, somebody says 2019 to me now, and I'm like, oh, that was last year. Oh, no, that's 4 years ago now. Oh my gosh, where's time flown?
Because, of course, as we all know, we launched the show. We had 3 programs that went out before COVID came along. And then radically, the show completely changed. And we spent 2 years pretty much producing the show from home with a team that we had. And then because of the success of the radio show, we realised that actually this is a great resource. And Cornwall Mind then took it on and decided that we wanted to keep it going. And the way we thought we would do that is to actually convert it into a wellbeing group so that people can come along, learn some radio skills, talk about mental health themselves within the safe space of a Cornwall Mind wellbeing group. And then from there, they can produce content or even just learn some technical skills. It's not about being on the microphone necessarily, unless that's particularly what they want to do, but there's technical skills to be learned. There's the studio desk. We do some exercises as well about talking and having conversations. So hopefully by the end of the 8 weeks, people feel confident enough to want to tell maybe their own story or the stories of those that they've had through their lived experience. And we've run 3 groups now. We're coming on to the 4th one. And through each of those, people have stepped up and really opened up about their mental health. And we realised as well, also releasing it as a podcast will get more people to be able to listen and be involved. And obviously people hearing those experiences of those that come onto the show, helps them as well. So it's kind of a double benefit that people that are involved gain something from talking, but also those that can listen to the show, not just in Cornwall, but around the world, can get something hopefully from what they hear.
No, absolutely. As I listen to you, I'm like, this is much more of a professional setup than the 125-year-old kid in his bedroom. No, I'm joking. But
you see, that's what we found within the community radio station. They were so helpful for us and they allow us the space to come in each week, and we've got all their resources there. But as we've all had to do, we've had to adapt over these last couple of years. So now, I can do things from home and chat to you from home as I'm doing right now. So that's kind of how we came about. But what about you? Because you've been going, is it a couple of years now?
So how long have we been going? So the first podcast was released in June 2022. So we've only been going kind of a year or so. And it came out of what young people were saying to us was like, we wanted to hear like the positive side of mental health. We hear about sometimes the negatives around waiting lists. We hear about the negatives of, I don't know, the environment, pollution, whatever. And there's a lot of negative news out there that's covered quite a lot. And I remember in one group, a young person saying to me, I don't want to hear about the negatives. I just want to know how to get better. And so from that, basically, we continue that conversation with a load of young people. It's like, what do you want to hear? They were like, we want to hear about coping mechanisms, we want to hear about people's stories, we want to hear about the positives. How do they manage day to day? And so in the same kind of respect to you guys, it was like that lived experience. And I think is so important for people to hear. I guess in some respects, I'm looking at yours and go, oh, how can we create a well-being group in the future that's around kind of the production of a podcast? Because I think that's so important. I think that's where your project is so amazing, is that you could create and develop them skills and a bit of purpose alongside that lived experience and understanding different people's stories. And I think that's great. And
also we incorporate the 5 ways to well-being. So it is about learning, it's about taking part, being active, getting those skills, being in a social environment. So the fact is, the responses we get is when people come in, if they've not had a great week, they're learning, they're able to talk, they're able to just for an hour or an hour and a half, just switch off from what else is going on in their lives and do something beneficial for themselves, but also for the group, as I say. So, and then at the end of the session, we're fired up and we're thinking, wow, we've just created some really good stuff, but we've actually had a really nice time in each other's company and producing up the show. So, I think that's what's really great about what we've done so far with the 3 groups that we've had. And as I say, working on to the 4th group, having something that also people then can take away. So the idea is even after that 8 weeks, they can still be involved with the radio show, because by that point, they'll have learnt how to record, they'll have learnt the editing software, which is free to download on their own computer. And of course, now we can use mobile phones to record broadcast quality sound so that they can go off and do their own things in their own time and when they want to and still be part of the show.
So if you are listening, because you get the statistics, don't you, of like where people have listened to and when they've listened or how long they've listened to. If you are listening from York, I don't think you're going to be able to access the Cornwall Mind wellbeing group with a space to be online. But if you are kind of close to kind of Cornwall Mind, how would you access this support? How would you get involved?
So we have referral forms, which we've just redesigned on our website at cornwallmind.org, so people can go on there and they can refer themselves or they can be referred and they can be part of the group. As I say, we're running it every 8 weeks, and so we can get 4 or 5 groups within the year. And as I say, we're also broadcasting now on a number of community radio stations in Cornwall, and we're hoping in the future to be able to use those facilities and maybe do a few more groups, because Cornwall is such a big area geographically, to be able to have the groups at other locations to the one that we're currently at. So that is the aim, and hopefully within that point we'll have more people on board producing more content, and hopefully even doing the show more regularly. So we might even have 2 or 3 a month that are being produced.
No, that's ace. Go on then, let's delve into the depths of the podcast. I want to hear about, because obviously you had a background in radio already. Was there, moving across from radio to then creating sort of within this project, was there something you didn't quite expect when you started producing it in comparison to the radio show?
Well, I think for me, the bits that I loved about working in radio was that we used to do quite a lot of community projects, and we used to do a lot of social action initiatives as well. And that was the bit I really, really loved. And that's why when I thought about the radio group as it is now, I thought that's the bit I'm really passionate about. And that's what I wanted to do. So it was a case of how do we transition from being this online, as we were during COVID, into a wellbeing group, and would that work, and how would people get on board? And I think one of the stumbling blocks as well is I think it can seem a little bit daunting if we say, oh, we're doing a radio group, because people think, oh yeah, broadcasting and microphones and studios, and if they've got no experience whatsoever. And you don't need any experience to be part of our group. As I say, you can do as much or as little as you want, and how you want to take part. We obviously changed the weeks to accommodate what people want to learn and want to achieve. But that was the kind of testing point. It's like, how is this going to work, and will people actually want to come along, and is it too much of a scary thought? But as I say, everyone that's been in, and I don't think we've had anyone that's had previous radio experience, they've all come in and got so much from it. So that was the big testing thing. And also that's what I personally get from facilitating the group, the fact that you can see over the weeks people progressing, and we do all the things within Mind, such as wellness action plans. So we can actually monitor how people are going through the groups and seeing if there is a positive response. And that is what is happening. So that was the challenging part, but that's the bit that is, when it happens, and it does happen, that's the most rewarding.
No, I guess when you always go to any sort of well-being group, peer support group, you're always sometimes worried about that sort of expectation of what's going to happen. And then when you add sort of a radio show, or we say it's a radio show on top of it, people go, oh, is it live? What if I get it wrong? Like, what am I going to say? Can I get rid of it? Or can I change it? And I guess that's the beauty of doing it in the way that you've done it, is that you can edit it, you can change it in the same that we've done it as well. Like, first time I went on radio with my job, I was bricking it. And that was live, and I was like, oh no. And then I was like, do you know what? The podcast. And then I said that to the young people. I was like, what about a podcast? They're like, oh no, that'd be great, because then you can get more different people involved in it, and it allows people to have like a say in how it's edited. And I think that kind of eases some of that pre-inhibitions about, oh no, what's it going to be like? And once you get kind of past that barrier, people go, oh, right. Actually, no, this is all right. It's just learning them skills and kind of sharing that lived experience.
It's strangely cathartic as well, because you kind of think that going into a radio studio, with the microphones, people would actually kind of clam up. But it's amazing. Once you're in that open space, people do talk very freely and openly. And again, that's why we do pre-record, and we always check afterwards. Is everyone happy with what's been said? We always make sure as well, the people that have spoken about those kind of topics that, they may have never spoken about before, or they may be a little bit cautious, that they are happy with the content. And that's the thing. We don't do interviews. That's we have very few rules, but one of the rules is they're not called interviews. We have conversations and get to decide what is broadcast in the end. And if they're not happy with something, we take it out, and we always make sure that everyone is happy with what we broadcast. But yes, it is amazing that suddenly there is that sort of freedom when you do get to talk. I have lived experience of mental health. For me, I never talked for years and years about the things that I went through panic attacks throughout my whole adult life up until probably about 5 years ago, anxiety, depression, many of those other things. So I know how daunting that prospect can be. But radio was always my release for what I was going through. It's my sort of safe space, and hopefully other people get that as well.
Do you know what? It's funny you say that, because you say that you didn't want to you weren't very open about it, didn't want to talk about it at first. And then running a radio show is like the complete opposite. It's the amazing thing, which when I chat to most people who've come on the podcast, who've come on Chat-Chit, once again, I agree with you in terms of we don't do interviews. I mean, it's called Chat-Chit for a reason. You have to say that very, very well to not get it wrong. But I always chat to people beforehand, and it's like, oh yeah, I'm a bit nervous, or I'm a bit anxious about potentially coming on. And when you speak to everyone, they go, yeah, I used to never speak about my mental health. I never used to want to talk about it. And now I'm like, now you're sat in a room doing a podcast about it, and seeing that difference of how far somebody's come, and go, actually, I really want to share my story. I want to share my lived experience and how I manage, because then if it can help one person, 1%, then that's amazing. And the impact I think that can have on someone's own mental health is like, do you know what? This podcast got X amount of listens to, and that might have helped just even one of them people would have been amazing if that helped. And I think that's one thing I find so rewarding, that I didn't expect to find so rewarding about the podcast when I started doing it.
So what have been your highlights in the time that you've been running the podcast? Are there some standout moments for you?
Do you know what? I'm a bit of a geek in terms of things like stats, but you can see where it was in all the different countries around the world. And when I saw that finally we broke through to Africa, we'd hit every continent, and I was like, yes, there we go. All the continents of the world have listened. That was one of them. One of them was because I go into schools and do assemblies and do different things to both promote it and the website we've created called Your Mind. It was really nice when I went to then an external kind of youth group, and a young person came up to me and went, "You're that Chat-Chit guy?" And I was like, I am that Chat-Chit guy. And then they were like, oh yeah, I've listened to you talk about jam a lot. I was like, because basically my episode talking when I was struggling with my mental health, I basically, whoever's listened to Chat-Chit before will know I go on a lot about jam. But it was the thing that gave me purpose. It was the thing that got me out of bed. And I don't know why, but it just helped me. And this kid came up to me and was just like, oh yeah, you're the guy that talks about jam all the time. And it was really nice just not expecting to kind of have that, and that they already knew about it. And that was really quite heartwarming in some respects. And on top of that, I was in a school in York, and 2 young people came up to me and was like, we really wanted to start our own sort of like peer support and lived experience group, and this has allowed us as a bit of an in for that. And I was like, amazing, that's the whole point, if it can ripple effect. And that was, I think we sometimes, I don't know if you're the same, Richard, but I think sometimes we always think we need to solve and change the world with things, sometimes the things we do, and we get too big a picture, and it's like, oh, I can't do this, I can't do that. When actually what we need to focus on is just helping the one person at a time, and realizing that can ripple and that can ripple. And if we all just keep helping one person, that can help a lot of people in the long run.
That is the biggest thing when I've heard people that have either listened to the show or been part of it, and you hear that story where they say, you know, thank you for having had the opportunity to talk about their story, or the fact that they've benefited from telling their story. And we do occasionally get those messages, and I'm sure that there's probably more stories to be told that we don't get to hear about, but it is really nice when you hear that one person saying, I'm so grateful to be able to talk about this, and you just kind of see what it means to them. And throughout the wellbeing groups that we run here at Cornwall Mind, those stories we do hear more and more often. And you're absolutely right. If you're helping one person, then you know you're doing something right.
Absolutely. And like you were saying, because it's quite a cathartic exercise in itself, both for us who might be having a chat to somebody about their lived experience, but also the person who's talking about their lived experience. I think when you get to the end of it and you release them and you've produced something, it's like quite a actually, it's almost cathartic in the sense you've looked back on your experiences and how you manage, and you've got, I've come a long way here. And that in itself, and how many episodes have we done now? 36 or something. And so it's like, oh my gosh, 36 people have all walked into the room, talked about their experiences, been very open and honest about what they've been through, and are all in a better place now than they were. And that is in itself is quite, even saying it now, I'm like, do you know what? I've never really put it in them terms. But when you look back and you go, actually, that's a lot of people and they're then trying to help a lot of other people. And that's just such a positive way and of like trying to deal with a lot of people's mental health problems.
We celebrate things like Times Talk Day and World Mental Health Day and Mental Health Awareness Week. And I think Times Talk Day, for me, is the big one, because that encompasses what the show is about. It's the fact that let's talk openly, and people still come on the show now, and we have those same conversations about stigma and the fact that especially older people might not talk as openly as maybe the younger generation. But the fact that we are having that open discussion, and radio for us becomes that avenue for people to actually open up about their mental health. It all kind of fits into place, and we just think it's great to be able to have that tool. That's what the radio program is. It's just a way of allowing people to have conversations. And if we weren't recording it, we'd still be doing exactly the same. We'd still be in the room. It's just we wouldn't be recording it, and then people wouldn't be able to hear the conversations that we're having.
I guess because there's so many, millions of podcasts now, isn't there? There's so many that and we're pretty much promoting 2 of them. But I think the one thing that I really like both about yours and ours, without sounding arrogant, hopefully I don't sound arrogant, is they are real conversations. Like, I don't script any of it. I don't read anything out. I just sometimes turn up on the day, have a check-in and go, do you know what? I think I've said it in one of the most recent podcasts. I don't want to be a podcast host today. So what I'm going to do is just have a chat with a friend about mental health and how we manage. And I think sometimes that rawness is really good, because it allows people to then go, oh, they are just having a normal chat, and maybe I could do that as well. Or maybe I can have a normal chat with somebody else about my mental health. What do you find hardest about doing it then, Richard? About doing the podcast?
I don't think there's anything that's particularly difficult. I think when we start a new group, I always want to make sure that people feel comfortable, because we are in such a small space. That's the main thing. Having the group, I just want to make sure everyone feels comfortable in the fact that they can come and go as they please. We take several breaks. That's kind of my sort of concern. So every time we do the new group, I just want to make sure everyone feels comfortable. And that has always been, as I say, successful so far.
In the true Chat-Chit fashion, and in terms of coping mechanisms, how do you then manage your kind of anxiety around that? What's the way that you manage yourself?
Well, I mean, the radio show for me is something that helps me because I'm creating content, I'm producing something that I'm really passionate about. And obviously for those that gain something from it by being part of the group, that is a real lift. But in my personal life, as we've mentioned, exercise, that's a big thing. It's all the things that we should be doing, you know, sleeping the correct number of hours, being good to ourselves and eating the right foods and socialising as well, just being out there, because sometimes, especially in Cornwall, that there is a high amount of isolation because we do have so many small towns and it's very difficult to travel across the county. So I think having that social aspect is something that I think we all have to be mindful for. So it's those kinds of things that help me, but definitely the radio group and producing the show is a big part of that.
I guess that's that purpose-driven stuff, isn't it? It's the thing that you can kind of fix your eyes on and go, oh, I really want to do this well. And that drive to get out of bed. And that sometimes I lost that at times, and jam was the thing that brought it back, ironically. But then for me, then it's my job, it's playing sport, it's them things like that that really do kind of put things in perspective. And like you said, having that purpose of creating the radio shows, doing all them other little things on top, just kind of allows you to have different pots in different areas where you can kind of focus on when things might get a little bit tougher at times, and that's completely okay. Sometimes you have to rely on different things, and that's completely fine. Going forward with the project then, what's on the horizons for a space to speak your mind other than this podcast?
As I mentioned before, what we'd love to do is to be in more locations so that people can access the Wellbeing Group. That would be the ideal, and to just be able to produce more content and have more people coming through. I think, I say, we've only got a small space at the moment. We only have a limited amount of people, and that's the other thing. You know, I wouldn't want a large group. I only want people that feel comfortable in a small space where we have maybe 4 or 5 within the group. So being able to do it more often and just to produce the content and people to get something from it.
That sounds great.
And what about you? What's the big plans? Because we've talked about what we're doing, and I'm sure there's a few things that we're doing that probably sparking ideas for yourself. So where would you like the show to be in maybe a year or 2 years' time?
Oh, well, like I said there, I'd love to have a wellbeing group around it and like allow people to have access and be able. I had an idea the other day that I was like, oh, right, which local radio do I need to get in touch with, and have like a monthly slot on there to try and do some sort of wellbeing channel. Going forward at the minute, it's just because we've got kind of a bit of a bank of episodes at the moment with loads of different things that people have talked about. I've created a bit of a catalogue of like whether you want to listen to the episode specifically about anxiety or depression or activity or sport or purpose. I've kind of put them in a big catalogue. So I'm going to release that so people can find it easier to get to the episodes which are most relevant to them. And then going forward, just kind of get a wider range of people and stories on the podcast. It allows people to resonate with different kind of beginnings, different things in their life which make them feel more at ease with the podcast and go, oh, that person sounds like me. That person has got a similar story to me. So just to have it as far reaching as possible so as many people can benefit from it. Who knows is the question. It seems to have gone a long way in a year so far. So if we can keep producing things like more well-being episodes, like particular tactics or particular sort of strategies that people can use on top of people's own experiences, we'll go from there. I mean, try and get a local celebrity on at some point. You've had some celebrities on yours, but we haven't yet broken that ceiling.
And I was going to ask as well, because it's such a great resource having this podcast and yourselves up there with York Mind. For those that are listening in Cornwall or are just listening to our podcast, where can they go to hear your podcast?
So we are on Spotify, Apple, all the usual places. We also have produced a website called Your Mind, which is specifically for people in York, but it also holds a place on there. So, but anywhere you usually get your podcast, so all them usual places. But we also have an Instagram as well called, amazingly, @Chat-Chit Podcast. And that's when I'll say, oh, there's a new episode coming out, or it's just come out, or a little shorts of them all. So if you do want to have a little taster on there, you can follow that as well. Shall we finish with a checkout?
It's so nice to hear about another podcast that's happening that Mind are facilitating. I think it's really great that we're getting these podcasts out there. It's so nice to be able to chat with you, and hopefully we can do things again in the future. So I'm feeling really positive, and I think we've had a really nice conversation today.
No, it's been great to speak to you, Richard. I have had a lovely chat, and I hope we can work more in the future, Richard.
Thanks to Chris, and you can hear the full conversation and hear all of their past episodes by looking for the Chat-Chit podcast on your favourite podcast app.
If you missed anything, you can download the podcast right now on
Apple Podcasts, Google Podcasts, Spotify and Amazon.
For support and more information for better mental health, visit the Cornwall Mind website or call the Mind helpline during office hours on 0300 123 3393.
You can phone the 24/7 NHS local urgent mental health response phone line. It's free to access by anyone, any age, on 0800 038 5300.
And don't forget, you can always call the Samaritans anytime for free on 116 123. If you'd like to be a part of the show, you can get in contact. Just email spacetospeakyourmind@gmail.com. You can also follow us on Twitter @spacetospeak or like us on Facebook.
I'm Richard, thanks for joining me this time, and I hope you'll join me next time here on A Space to Speak Your Mind.